Today's for the teachers who have reached that Medicare age or they're thinking about retiring and they need to know if they need to stay on their group plan because they're going to continue to work. I get this all the time. Four times this week, I got it. Alyssa, I'm a teacher. I'm going to continue to work. I need to know if I need to enroll in Medicare or stay on my group plan, or it's Alyssa, I'm going to retire and I have a teacher's retirement. I'm talking about TRS today, specifically the one in Texas, but the ways I'm going to tell you how to compare your teacher's retirement plan really is going to apply to every state. So let's get into what specifically teachers need to look at when comparing their plan to whether they need to go on Medicare. Some stay put, some leave, some get a private plan. So let's go over those scenarios. Okay, so if you're new here, there is a book that I have written, especially we're talking about teachers today. Teachers love books, especially ones that they can write in and scribble in and take notes. I've never met a teacher that doesn't like to take notes. My own sister is a teacher, so know you guys. There's a book down below in the description that you can buy and just kind of thumb through Medicare and learn it at your own pace. There's also a free Medicare 101 webinar that you can attend. Feel free. It's a very 101 webinar. I always say that. So that's about 30 minutes long. You should get the basics of Medicare from that webinar. As far as the teachers go, well, I'm not talking about Social Security and things like that. I am talking about their option to go into the Teachers Retirement Advantage Plan or not. We are going to review what the 2024 plan looks like this year. And again, I am reviewing the one here in Texas. I can't imagine that other states look too far different. I can expect there to be some similarities, but what I'm going to point out, the bare bones and the skeletons of what I'm going to point out, you can also pick out on your own state's plan. So some of the things that I noticed right off the bat with the 2024 Texas TRS Medicare Advantage plan is that it's got a kind of a hefty premium for Advantage plans, $135. Some say hefty, some say not. Here's what I'm comparing it to is the rest of the private plans offered in the area, which in the area, again, speaking of Texas, I don't know what the percentage is. It feels like around 80% of the Medicare Advantage plans are $0. So if I have a group of teachers and they're talking amongst themselves and one of them starts to scratch their head and says, well, wait a minute. My friend says that she doesn't pay anything for her plan. What's the difference between my plan and the plan that she's got? So there are some key points that I want to point out about the TRS Advantage plan and why I think there's a premium. I'm taking my views out on the whole TRS system. Okay, I don't think it's managed well, so that's all I'm gonna say about it. But you got to deal with, what you got presented to you, which is if you're a teacher, do I go on TRS Medicare Advantage? Do I go on possibly a Medicare supplement for the same price? Which is my favorite option, and I will talk to you about that. Or are you strapped and you cannot fathom because this is on top of the 174.70 that Part B requires. So you are having to pay that every month. In addition to that, it's the 135 on the TRS Advantage plan. And so some people can't fathom that and they want to go into a $0 plan. And that's an option all in itself as well. And I think that pretty much sums it up right there. It's a financial thing. So let's get into what I'm actually going to share my screen, what a TRS summary of benefits looks like. And I'm going to point out those things that kind of speak to me as far as what you should consider when looking at this plan and possibly comparing it to another option. And for time's sake, I am going to speak of the option of comparing this to original Medicare as your primary with a Medicare supplement as your secondary. The only reason why I'm doing this is because it's kind of the same amount, the 135 a month. It That's the norm for a plan G in Texas. There's actually less in some counties. I think here in Bear County, it's 98 dollars, $115. So it's somewhat the same. So if a teacher comes up to me and says, "How can I best spend my $135?" I personally don't think it's with a TRS Advantage plan. Now, before I get into it, because I can just hear some comments coming in. Um, TRS Advantage plans, it being a program, they don't allow teachers, as of right now in 2024, they don't allow teachers back in if you leave. Add that on the list that I don't like. Um, I don't see the reason why, but there is chatter to say, and it's been in the news as well, that they are considering lowering the premium because they are hearing teachers speak and saying that it's too much compared to the other Advantage plans here offered in Texas. Um, but they're also saying, well, if it was a lower price, I probably would have entered it. So they're also having almost like a TRS open enrollment. They're speaking about that. I don't know that it's completely done yet, but that's high on their priority list. The TRS system is to allow teachers to come back. So if you feel like you need to come back to this plan, 2025 may be the time that you can do that. So let's actually look at a plan. Enough talking, please. All right. So, and I know this is kind of small, but I snipped it out of a benefit sheet that I found on Google. So if you would like to Google along with me and zoom in on your device, go ahead and do that. And I'm going to use my little highlighter here and make it big. Okay. So again, this plan is a summary of benefits. It's not the detailed. See, it's only this one little snapshot, but it's perfect for the little bits that I'm going to give you to either contact your local agent or to reply in the comments. Maybe we can connect on the phone or through email. So $135 is the price to be a part of this plan. You have for $135, here's the first thing that we're gonna highlight, is you have a deductible of $400. When it comes to original Medicare, you have a deductible of $240. So we're doing a comparison of original Medicare as primary with a Medicare supplement as secondary, and for this conversation, we'll just use a plan G as in go. Original Medicare is Part A and Part B. So Part B being 174.70, and then a Plan G is you hiring a company like United Healthcare, like Humana, like Cigna, like Blue Cross Blue Shield. Every one of those companies not only has Medicare Advantage, but they also have a Medicare supplement. So the Plan G is going to pick up everything that the A and B don't cover for a monthly premium. Okay. Now that monthly premium is, let's just call it an average of 115. Let's just say 135. Let's just do a solid comparison, because if you go with the company now here in Texas, United Healthcare, Blue Cross Blue Shield, they're consistently they're like top shelf prices compared to Humana, Mutual of Omaha, and for no other reason other than I think brand. Remember that when you go with a Medicare supplement, there's no difference in coverage whenever you select a Plan G. A Plan G is the same with United, Humana, Blue Cross Blue Shield. You can have the same Plan G with all companies and it cover the same thing by Medicare law. Okay. The deductible at 400 for a TRS Medicare Advantage and the deductible for original Medicare as your primary, Medicare supplement as your secondary is $240. Okay, that's a small difference. You may be saying that. All right. And by the way, with a TRS Advantage plan, you still have to have A and B. You have to be enrolled in A and B here. It's not like you just get into this for 135 and call it a day. You have to have Part A, Part B, 174.70 plus 135. All right, I hope that's clear. All right, back to our highlighter situation. You pay 5%. Here's your coinsurance here. You pay 5% or only a copay after you meet the annual deductible. Okay, either 5% or a copay. And in most of these cases, it's going to be a copay. So let's just say you've hit the 400 and now you are privy to the copays, which aren't bad. Primary care, $5, urgent care, $35, emergency room, $65. Again, to any other comparison, this is pretty good. And to a lot of the teachers, compare this to their current group plan, it's a pretty good deal. But when you compare this to original Medicare as your primary and Medicare supplement as your secondary, after you pay the 174.70, you'll have the monthly premium of the Medicare supplement. You hit the $240 deductible with original Medicare. You don't have these little copays. You don't have these. Your Plan G would pick it up. So if I'm sitting here and I'm asking a teacher a question, well, why does the 135, why does the premium you pay here, why doesn't the plan pick it up after the deductible at 100%? Well, that's because this is a managed care plan. This is a PPO. PPO, which is managed care. And for this year, I'm pretty sure for next year too, United Healthcare will also be the servicing carrier. So you'll have to be within the United Healthcare PPO network. And not all doctors accept Medicare Advantage. Some doctors just accept original Medicare. So in the situation of comparing this to original Medicare, you have more of a network to choose from with original Medicare, hands down. If your priority is network, original Medicare wins all the time. If your priority is premium, well, most of the time, having original Medicare as primary, a Medicare supplement as secondary, you're more than likely going to find right at 135, maybe a little bit less for the first maybe 2 or 3 or 4 years of your Medicare supplement, because remember, Medicare supplements go up every year. So there could be a scenario, and I don't have a crystal ball, and no one does. They don't know what the premium for the TRS plan is going to do in the future, and they also don't know what the increases in the Medicare supplement world is going to do either. So could one possibly be above another at one point in the person's life? Absolutely. But going back to, all right, Mrs. Smith, teacher, she's going to retire. She's going to get Part A and Part B. But if the question is, do I take Medicare Advantage to a TRS Medicare Advantage or go with a Medicare supplement? And the TRS Advantage plan is $135. What can I get with $135 with Medicare? A whole lot more. Well, I should say, yeah, a whole lot more because it's less of a deductible and it's no continual copays coming out of your pocket. In 2024, there's still a donut hole that exists. We're going to move on to the drug portion, the comparison, because I think I've beat the copay and the deductible and the premium to a pulp. You should understand, I guess, where I stand. If you stand differently, please leave a comment below. I love conversation, and I'm not trying to say you should or you this or you that. Everybody's got their own scenario, which may warrant a different plan. That's why you should work with an agent. When it comes to drug plans, the 2024 TRS Medicare Advantage plan, you cannot hit the donut hole. This is big, especially in the world of that we're living in, the Ozempic world, the Manjaro world. What's another one? Ozempic, Manjaro, the semi-glutide world. Let me just cover it. I hear horror stories of some people paying, $400, $600 a month for their Ozempic. Teachers don't run into that because they don't run into the donut hole. So if you are on very high costing medication, Eliquis, Trujillo, what's another one? Farxiga, Jardiance. So anything that is high tiered, a very specialty medication, you probably want to stick with your TRS plan because what you save in copays with original Medicare, you're going to spend way more than that having your drugs, um, having to pay for your drugs out of pocket with original Medicare. Because with original Medicare, you get a Medicare supplement, but you also have to get a drug plan that's separate, and that has a donut hole because it's a private plan. It's not a retiree plan. But in 2025, riddle me this, if they're going to cap the amount of money that one spends, which is $2,000 out of pocket on their drugs, doesn't that level the playing field a little bit? What is TRS going to do if the one thing that they had going for them being a no donut hole, which was big. There's a lot of teachers on a lot of medication. Then what is the plan gonna look like in 2025? And that's where I gotta cut you off. I gotta put a pin in this video because in October, November, December, that's when we'll start to learn plans for 2025. We're gonna learn the price of drug plans. The video may be null and void come this October. So if you are a teacher, these are some things you need to consider. The premium you're paying for your plan, what copays after that premium you need to hit, what the max out of pocket is when you need to hit, and what kind of medications you're on, aka how's your health. And when you compare that, and especially the premium towards, all right, what's my $135 gonna buy me in the Medicare world? And then, all right, let's just say a hospitalization happens in the Medicare world, and then a hospitalization happens in the TRS in your retirement advantage plan world. How do you fare? And that's really the questions that I ask for every comparison. Group versus Medicare. Hey, I'm going to continue to work. Do I need to join Medicare? I don't know. What's your group plan look like? Hell, half the people don't even know what they're paying for their group insurance. So, how am I supposed to make an educated decision for your own health if you don't even know what you're paying for it? Figure that kind of stuff out. You're 64 or you're past 65 and now you're about to, retire, learn the premiums for everything and what that's going to buy you, what it is in a good year, what it is in a bad year. And then you're able to make decisions based on numbers, not emotion, fear, what your neighbor said, the agent that gave you the free, dinner at the seminar. Uh, Numbers, facts. Make decisions based on that. So that's it for me. If you got anything out of this plan, teachers, I know you got a lot of questions. You might as well just type them in the comment section. I would be happy to help and even be happier to connect with you. Teachers, I hold close to my heart because my sister is one. Uh, there's not enough of you, and there's definitely not enough great ones of you. You know who you are. If you're a great teacher, you know who you are. Like, comment, subscribe, and I'll see you on the next video. Bye now.